If you or your near ones is detected with brain tumor and you're looking forward for something substantial which can avoid the brain surgeries and resolve the brain tumor, then you're at the right place. Hi friends, I'm Dr. Ashita Nandgaonkar from Medico Experts and I welcome you all into the Cancer Awareness Initiative. So today in this video, we are going to talk about a form of radiosurgery which is more effective yet less recognized. Yes, I'm talking about CyberKnife. So stay tuned with me till the end of the video to know what is CyberKnife, what are the advantages of CyberKnife over surgery, how CyberKnife works, and yes, what are the indications of CyberKnife where all it can be used. Imagine having a tumor which needs excision and for which you will have to open your skull. That is scary. I know. But what if I tell you that you do not need excision or opening of your skull? You do not need to undergo a knife and still the tumor can be removed. Moreover, it is more precise, less complicated and far more successful. Would you like to know more about it? Of course, then let's move ahead on it. Yes, here I'm talking about the latest neuroradiation, the CyberKnife technique. So let's first start with what is CyberKnife. It is one of the most advanced form of radiosurgery, which is non-invasive, painless, and delivers a high doses of targeted radiation beams into the tumors and lesions within the body. CyberKnife is the only motion synchronized personalized form of radiation which delivers a real-time thin beam of radiation. Let's now understand what are the advantages of CyberKnife. CyberKnife treatment offers various benefits over surgery as well as the other form of radiation. So let's start with the first one. Incomparable precision. CyberKnife treats benign as well as malignant tumors from around 1,400 different angles without damaging the healthy tissue to the adjacent angle. So it is the best suited option wherever the complex, or you can say wherever the important adjacent organs are involved. Second is no hospitalization. CyberKnife is a technique in which you need not stay in the hospital. You can just take the therapy and go back home. Third is no pain, no anesthesia, and no recovery. You need not worry about losing your blood or getting under the knife or having any kind of scars. So there is no recovery time. You can just have the therapy, just have the treatment and go back. Fourth is faster treatment. So around 1 to 5 fractions are being planned, which can be planned within a week or 2 weeks of time. And that's it. You're done with the treatment. Fifth is excellent outcome. So as much as good of a surgery can help you, the same way, CyberKnife is found to be efficient enough as compared to the surgeries without having pain, recovery time being involved. 6, tracks the movement. Now, CyberKnife technique itself tracks your movement while breathing, swallowing, gulping, so that even if the tumor is moving, it can still target in the right place without destroying any healthy organs. Isn't that all interesting? Now let's understand how exactly the CyberKnife works. I'm sure you all are curious to know about it. So how does CyberKnife work? CyberKnife uses a high energy X-ray machine on a robotic arm which delivers the high targeted beam of radiation with different angles to the body without destroying any kind of healthy tissues. A CT scan and a 3D imaging of the targeted image is being taken, wherein all the angles can be explored. In addition to that, a dye is being injected intravenously, which helps and guides the movement of the tumor wherever it has been set, so that there is no missing of the targets or any movement in the tumor does not cause any kind of repercussions. The number of fractions and the number of the doses that is required is dependent on the pre-imaging that is done before the CyberKnife treatment is started. So during the treatment, the patient is asked to lie on a couch comfortably, and then this imaging is taken again to monitor the movement of the patient before starting the treatment. Now, the comparison between the previous image and the images that are taken during lying of the patient on the couch are then compared, and again an alignment is being formed wherein the targeted area is seen and the beams are then radiated from different angles. The radiation is delivered with computer-controlled robotic arm. So this way, CyberKnife reduces the damage to the healthy tissues and recovers by reducing the margins and accounting the body movements. Interesting, isn't it? So now let's understand what are the indications of CyberKnife, or you can say where all can CyberKnife be used. It's a great option for patients who can't or do not want to go for surgery and have a minimalistic tumor size, along with those who have complex surgeries or complex places where the tumor is residing and you need a preciseness. Tumor treated with CyberKnife are as follows: brain tumor, spine tumor, skull tumor, liver tumor, prostate tumor, breast tumor, lung tumor. These are the most commonest site wherein CyberKnife can be the best option. So if any of you or your loved one is suffering from any such kind of tumor, do go visit your doctor and let them know if CyberKnife can be your option. Although with so much of benefit, it comes with a little bit of limitations. Now the limitations are on the size of the tumor. So totally, if CyberKnife can be an option in your case or your loved one case would depend on the size of tumor. Mainly it is done in cases wherein the size does not exceed in mm. If it is in centimeter, sorry friends, but that might not be a good option or a selective elective option in your case. So with all this, CyberKnife becomes the popular choice of options for patients as well as doctors wherein tumor can be excised without any surgery or without any cut. Its accurately calibrated radiation, zero risk and no recovery time makes it more popular within the people who actually want to get the treatment done at the no recovery time period. Although, as it is a very newer treatment that has been started and an advanced level of treatment, it is suggested to be done under experts monitoring only. So if you need any other information on CyberKnife or any other form of treatments in oncology, any advancements, then do feel free to contact us on Medico Experts. Below given are the details of the contact number. Now please share this video with the people who can be benefited out of it. I hope in this video I was able to equip you with the right knowledge of the